Good morning, everyone. My name is Gianni D'Enrico. I am the coordinator of Regions for PerMed. It is a real pleasure to present today, with the help of our stakeholders, the project Regions for PerMed, its main outcomes, and the work that we have ahead. I would like to thank, before we start, the organization of the European Week of Regions and Cities for giving us the opportunity to present and to include our project and our initiatives in the program of the event. It is also a pleasure to have the possibility to speak to the regions and to the municipalities of the European Union, because we believe that for the topic that we are tackling, which is personalized medicine and the transformation of healthcare in Europe, they are really important, and it is of paramount significance to cooperate with them, to liaise with them, and to coordinate all our actions towards a common goal. I'm delighted to introduce the first speaker. Today we have four speakers, which will bring different perspectives and which will allow us to brainstorm at the end on how we can involve regions and cities on personalized medicine. The first speaker is Jean-Luc San. He is a policy officer from the European Commission, the DG RTD. Please, Jean-Luc, the floor is yours.
Thank you, Gianni, for giving me the floor to introduce this session. I'm very pleased to stress the importance of the regions in personalized medicine, because this was not obvious from the very beginning. It's an evolution. We realized that the regions, in fact, are at the heart of ecosystems, including research and innovation, including healthcare, including education, including support to industry. And so they have a major role to play, although the regions have different status according to the different countries in Europe. In some cases, it's very centralized. In other cases, it's much more decentralized. But there is something to do here. And if I may have the first slide. I will not have a lot of slides, but I wish to mention a few elements. The first point is the fact that we have different challenges to address to link personalized medicine and the regional dynamics. The first thing is the place of the regions in the value chain of personalized medicine, and the need for inter-regional cooperation, because very often the regions have a strong position in some domains that are of major importance for personalized medicine, but they need to cooperate with other regions. They also need to share experience, and that's the European framework is a good one to allow this cooperation, because it's interesting to have inter-regional cooperation inside a member states, but very often it's also outside, and you find former historical links between different regions, cross-border regions. The second challenge is, of course, to translate research and innovation in healthcare, and that's where I think the regions, because at different levels they have a word to say in healthcare, or responsibilities in healthcare, regions have a lot to do. And the third challenge, which is not also very easy, is to find synergies between the different research and innovation programs and link them together in the EU healthcare systems. I'm thinking a bit about different programs, regional, national, and European programs. And even when we consider European programs, we have different programs that are of interest to personalized medicine in the regions, Horizon Europe, but also the EU for Health program or digital program. So it's a challenge to make all this work together. This is an old slide, but it's just to mention that 2 or 3 years ago we tried on the risk-free of the regions to see whether which were the regions that included personalized medicine in their priorities. And you see a lot of blanks, and I'm pretty sure that if we do this exercise next year, we will have a complete different picture, because many regions will mention personalized medicine as a priority for research and innovation and smart specialization. So, but already we see this picture that was, I think we made it in 2018, that we had already a lot of interest from the regions in personalized medicine. We tried to do a lot of things. Indeed, we have the traditional calls for proposals where the regions can participate, and institutions in the region can participate. But I wish to mention here that the existence of the International Consortium for Personalized Medicine, which is a consortium in which the Commission is an observer. It's driven by the member states, health ministries, but also research funders in the member states. And the regions joined this international consortium, and there are many regions now that are part of ICPermed, which is a very interesting forum for the future, for discussion, for aligning priorities. The second thing we've done was to start a mapping of the research priorities. We started this exercise at Commission level. Now we have coordination and support actions that are doing the work now, continuing this work. So it's done outside the Commission, but it's very important to see the evolution. We have also these thematic partnerships under the GRC Smart Specialization Platform for Industrial Modernization. It's a web platform that allows regions to get connected and work together, and it's linked to the program of the regional funds. And last but not least, we have coordination and support actions, which were understood from the Commission side as CSAs to support the activities of ICPermed, because ICPermed is a kind of forum, but the Commission is supporting different projects in line with ICPermed. So this project for the regions, other project for international cooperation, an ERANET, the Secretariat, so we are supporting two. And so we have two CSAs. We have the Regions for Permed that Jenny is coordinating, and we have another CSA Saphir, which is complementary. And I know that the two CSAs are working closely together to deliver the best to ICPermed and the EU, and we are contributing to the next step of the development of personalized medicine. And I think that, which will be my concluding slide, that the next step will certainly be a European partnership for personalized medicine. We express our interest as Commission in having such a partnership. We know that ICPermed is very interested in having a partnership in personalized medicine. The participating regions are also very interested. And currently, the member states are working on the preparation of a proposal to the Commission for a partnership on personalized medicine. What I need to say is that this partnership is much broader than the former ERANET, and the beneficiaries, and the regions can be beneficiaries of the partnership, can accommodate for different activities, including activities that are not strictly research activities. And that's one of the main interests of this, is that the region can, for example, link to the activities of the partnership other activities like a curriculum in the training of medical healthcare providers. And so it's very interesting to see that this will certainly allow this collaboration this alignment of programs and also broaden the scope of activities. And so among the expected impact, we expect an alignment of research and policy priorities, including the member states, the regions, the associated countries, and international partners. So really it opens possibilities, and also synergies with other programs, including the regional programs and regional funds. So we expect a lot. For the moment, the member states are leading the negotiations for the first proposal that we hope will be published. A draft proposal will be published in January, maybe a bit earlier. And then from that, we will introduce a topic in the work program, the next work program of the Commission. And we hope to have a topic for 2023. So this is the timeline. So that would allow then beneficiaries to submit a standard proposal to the Commission in 2023 for a launch of the partnership end of 23, beginning of 24, if everything goes well. And we hope to have a lot of regions on board. And I think that was my last slide. So thank you for the invitation. I told you, Jenny, that I will not be able to stay until the end because I have another meeting. But so if there are a few questions, I can stay a couple of minutes for you. Thank you.
Thank you very much, Jean-Luc. More than a question, I would like to maybe summarize the important points that you have expressed, which are the regions cover many points of the value chain of personalized medicine. They are investing, and we know that regions like Saxony, Lombardy, Tuscany are investing in personalized medicine research and development, not only at the local level, but also jointly within European contexts like the ERANET on personalized medicine. In many different member states, they contribute to the transformation of healthcare, as you said, either on policy level or updating the curricula of professional. They are responsible for healthcare and health data infrastructure. This is an important point because I believe that when it comes to personalized medicine in all the different nuances, especially when it comes personalized prevention, that is a topic which is encompassed by the personalized medicine, the health data infrastructures hold at national level and regional level will be really important to connect and to be valorized. And of course, this will definitely is paving the way for the regions to play a major role, an important role, as much as the member states in the coming European partnership on personalized medicine. So these are the points that I would like to bring from your introduction. And in case we have questions later on, I will come back to you and to double check if the answer is okay. So far, thanks a lot, Jean-Luc. And so this brings me to actually introduce some of the work, the project Regions for PerMed, just to provide some background information and what we are doing. As Jean-Luc said, the Regions for PerMed is a coordination support action. Just okay. Okay. Regions for PerMed is a coordination support action financed, granted by the European Commission in 2018, together with Sapphire, which is the other project which is complementary to us and with which we are closely cooperating within the IC-PerMed, which is the main policy forum on personalized medicine at the European level. What is Regions for PERMED? Just a few words. The Regions for PERMED is the acronym of International Coordination for a Fast and Deep Uptake of Personalized Health. I am the coordinator within Toscana Life Sciences. We have Saxony region, Lower Silesia, Galicia region, Fondazione Regionale per la Ricerca Biomedica, which is Lombardy region. It's a funding agency of Lombardy regions, and the Medical University of Wrocław, which is the technical partner of our project. The background, everything that Jean-Luc from the European Commission expressed was actually the background of Regions for PERMED. I mean, these information are at the basis of the work that we decided to carry out with the Regions for PERMED. Local and regional communities have a key role in delivering the benefits of the digital transformation to the public. They are responsible for 50% of public investment in Europe. They receive and reinvest 25% of taxes from the citizen, and they are the major public employer in Europe. In Europe, we have 74 regional assemblies, 280 regions, and approximately 80,000 local authorities. So this was like all these information were too important not to be included, and so we decided that if we really want to implement personalized medicine, if we want to bring personalized medicine to patient and citizen, we had to involve them. This is the pathway of personalized medicine, and this is summarize all the works that the European Commission is trying to is doing on personalized medicine. That we have the IC PERMED, which is the first project granted, the first coordination and support project granted by the European Commission. Then the European Commission supported the creation of the ERA PERMED, which is the funding, let's say the funding body, the funding branch of the IC PERMED, where over 30 actually funding agencies, national and regional funding agencies, are funding personalized medicine research. Then we have Regions for PERMED and Sapphire, which are focused on regional aspects. And then the European Commission also invested in international aspect, and there are two projects which are dealing with the relationship between Europe and China, so to involve China and commit China more and more to cooperate with Europe and with the IC PERMED. And another project is on the Latin American area. And then we have side projects, side initiatives, which are also connected to the Regions for PERMED and the European pathway for personalized medicine. This is what is called the IC PERMED family. So all the projects, all the complementary projects that have been supported by the European Commission are displayed here. And all these projects are now not only working on the aims of each project, but they are also working to deliver the best rationale, to deliver the best groundwork for the European Partnership on Personalized Medicine. The interest of regions before we started, and this is a slide that also Jean-Luc presented in 2018 or 2017 maybe, the European Commission surveyed the interest of regions on health research and in particular on personalized medicine, and the results were incredible. Like the European Commission realized that there were many regions already trying to work on personalized medicine, although the activities were somewhat disconnected. The main concept of personalized medicine were not aligned. So we decided that there was a need to align this work, to coordinate, to agree on the basic principles of personalized medicine, and try to coordinate all these efforts towards the same objective. And these objectives are stated here. These are the project objectives of Regions for PERMED, which are to coordinate European policies and innovation programs in personalized medicine, strengthen, reinforce the industrial specialization area in Europe, and allow personalized medicine to flourish as an emerging industry. We want to enable interregional joint investments on personalized medicine, and we want to provide guidance to the European Commission, the member states, and the regional authorities on how to better invest on personalized medicine, which is something we have been doing since the beginning of the project. The specific objectives, so how we are going to deliver these overarching goals, is we organize a technical dialogue with the regions and experts about 5 key strategic areas that I'm going to show you. We will provide a final action plan of strategic areas of investment. We have established a hub of European initiatives and partnership on personalized medicine. And we release guidelines to the regional authorities on how personalized medicine can boost local economies and keep the European Union competitive. These are the 5 pillars we have been working on. We started with the big data, electronic health records, and governance to understand the roles that regions have in the health data and data infrastructures, and how regions can support more investment in this area and to valorize, exploit the data to deliver innovation to patients and citizens. Then we started, the second pillar is on health technologies and integrated care. Then we went on personalized health industry to understand the needs of the industry when it comes to personalized medicine and how regions can support the creation of innovative industries and the work of industries, especially small and medium-sized enterprises working in the personalized medicine sector. We are now on the fourth pillar, which is innovation in healthcare, and we are now analyzing how the regions can support research and innovation itself, not only with grants, but also with the innovative tools like pre-commercial procurement and public procurement of innovation. And then we have the last but not least pillar, which will be on social and health economics, because we also want to understand which will be the impact of this transformation, healthcare transformation on the society, and this will be the last part of the project. The methodology, this is how we work. For each thematic area, we develop a position paper, a rationale. We organize a technical conference with experts to brainstorm about the main scientific and technical needs. Then we we discuss these needs and these technical aspects with the regional authorities in a workshop like event. And then after that, we also have some in situ visits, which we had to stop because of COVID, just to realize and to see how these innovations are working at the regional level. And at the end of this process, we deliver policy recommendation for the European, national, and regional policymaker. We deliver research and development investment recommendation, and we also showcase innovative models and best practices which are being carried out at the European level. So these are the 4 different aspects of our policy dialogue. Regarding the outcomes, we had kickoff meetings in November 2018 in Milan, where we had the participation of over 500 participants from more than 30 countries, and the main European institutions were represented. We had representative of the European Commission, the European investment funds, the European Investment Bank, and so on and so forth. Then we had the first pillar. We had which was also carried out in Milan. We had the conference and the workshop, and the first report was released last year in April. We also had the workshop and the conference on health technology. And the report is being published in these days. We are just now refining the layout with the support of a graphic agency. And then we have personalizing health industry, which also was report will be expected by the end of the month. And then we are now in the middle of the workshop. The workshop will take place on the 16th and 17th of December for the innovation in the regional settings. This is the interregional committee. So this is the list of regions which have already joined the Regions for PERMED, which are cooperating with us and which represent already a good basis for the work that has to come, especially when we talk about the European Partnership on Personalized Medicine. But as Jean-Luc said, we need a massive commitment from regions. So we decided that an extra effort had to be made in order to involve even more regions. So we decided to organize an event at the European Parliament, which will take place on December 1st. You can see also already the agenda. We have many members of the European Parliament which have supported us, many members also of the European Committee of Regions which have supported us and are liaising, are trying to connect with the regions in their countries to explain them the goodness of this project and how important it is to invest in personalized medicine. I'm just finishing with the scientific publication because we do also take care of that all our outcomes are in line with are scientifically sound, let's say. So these are all the scientific publications that we have released so far. And of course, we couldn't do this without the support of our scientific advisory board, which I take the chance to thank once again for their relentless support to our project. And that's it. This is my last slide. This is the team. This is the last pictures that was taken before COVID hit. And we hope that in the next few weeks, we will be able to take a new picture. So that's it from my side. I hope I have provided some background information. And so after this, I will give the floor to Dr. Andre Hoffman from Medical Forge Leipzig, because we always talk about how regions can support innovation, and what Dr. Hoffman is going to tell us is a concrete example on how a region, which is Saxony region, can support research and innovation on technology, health technology, and particularly on personalized medicine. Please, Dr. Hoffman, the stage is yours.
Thank you so much. So I'm trying to share my screen now to give you a short insight of what we're doing here. So just for short introductions, I will talk about Medical Forge, which is our main project at the moment, but I would also like to give you a short introduction to BioSaxony, which is the local cluster initiative here in Saxony. So what is BioSaxony all about? We are a cluster organization, as you know it from your regions as well. So we are based on the membership. We have 136 members at the moment, and our vision is to become a fully integrated cluster in the health economy, which means we want to be able to support projects from the very beginning in the labs, in the research centers, to the end when the new products are applied at the patient's bedside. We do basically the same thing as every other cluster organization around the world does. So we have the network events, the market studies, and so on and so on. You all know that. There might be a difference here in how we work. We are also the operator of the BioCity, which is an incubator building based in Leipzig. And I would shortly introduce you to the local ecosystem by going through the history of that. So in 2000, the year 2000, the state of Saxony started to invest into the health economy on a very strong basis. So they invested 200 million euro into infrastructure, setting up 2 incubator buildings, one in Dresden, one in Leipzig. They invested into scientific experts. So they hired 6 new professors in both cities, so 12 altogether, to lay a foundation for developing a health economy here. And out of that, step by step, a whole ecosystem was developed. So starting with support centers for clinical studies, for instance, here, support coming from incubators and accelerator programs, coming from networks like BioSaxony ourselves. And so this continued until just in the recent years, we had a specialized center for support of projects in the field of digital health and e-health solutions, which is based in Dresden. And one of the most important things that has just started a few weeks ago was the Saxo-Cell future cluster, which is focusing on cell and gene therapies, where Saxony is especially strong here in Europe. So there was a time when the first 8 ATMPs were on the European market. 3 of them had their origin right here in Leipzig, where I'm based now. Since we are talking about the support or the possibilities for regions and cities, I would for sure like to mention a few of the most important projects that we are pushing here. So one of them coming from the region of Saxony. Sorry, I don't know whether this is why this is forwarding the slides. One of the most important projects for us is the innovation cluster Smart Medical Devices and Therapies, which is run by BioSaxony ourselves. It's basically our backbone project, and this gives us the opportunity to support all the SMEs or the research institutes here hands-on in their project development. So the idea is to pick up innovation in very early stages and guide the companies with these innovations through all the regulatory processes, to connect them to partners from large medtech companies, for instance, or to connect them to clinics. To go through all those stages a project has to go through in developing a new medical product or a new therapy. So we're pretty happy that this is a long-term project. This is something that I have really to point out. So it gives us a basis to work on for altogether 10 years, which is not that usual. And we are thankful to have that because it keeps our minds free to look after the companies we're working with and not just finding new funding opportunities for ourselves. So this is a pledge for long-term project funding for clusters and support systems like we are. Another very important project that was already mentioned here is the so-called permit project, where the ERA permit is a very important puzzle piece in. So far, the ERA permit in Saxony has supported over 4 calls and is and is supporting 10 successful projects with a participation from Saxony, which means a total of 4.6 million euro that were handed out here. And in the forthcoming call on personalized prevention that's opening soon, Saxony will again commit up to 2 million euro into the participation of this research consortia. So this is a very important basis for the scientific community here in Saxony to develop their project from. But this is, as I said, the state level where we are operating. I would like now to switch over to a more city-based view, especially for the city of Leipzig, which is a very important partner in our network. And this brings us to Quali Biopharma, which was basically requested by the city of Leipzig. So they turned to us asking for support in their struggle to provide staff for life science companies, especially in the field of cell and gene therapies, which is, as I said, a big thing here in Leipzig. So they turned to us because there was a couple of companies had problems to find the staff they needed here for the work in their labs. And so we decided to change Biosaxony, or to develop Biosaxony into a structure that's basically training staff for the companies working here in the field of cell therapies, for instance. So by the end of the year, we'll become a entity that is certified for training staff in lab environments working on cell therapies, so-called GMP operators. So we are now developing a curriculum in combination with the Fraunhofer Institutes here, but also in combination with the companies that are part of our network, just to bring more laboratory technicians into the labor market here, because this is a bottleneck for the company's development here. So we'll have a pilot run in March next year, admitting 2 times 15 participants that have a ground or a basic knowledge for how to work in a lab environment, just to support the companies here and their growth. So this will be continued afterwards with more than these 15 participants in each run, just to give the companies the opportunity to further grow here in the region. But the most important project we are running here at the moment in Leipzig, it's called the Medical Forge. We are happy that just a month ago we got the grant that we were applying for, and we have been working on this idea for more than 4 years now. And I would just briefly walk you through the idea that's behind the Medical Forge. It is, in the end, an accelerator program, as you may also know from your region, but it's not focused on supporting the companies in raising capital, for instance, from venture capital and other corporate ventures, for instance. It's focused on helping them going through the regulatory affairs, for instance, especially in case of the medical device regulation, but also in other regulatory requirements like the in vitro device regulation, CE marking, and so on. So this is something we cover. We started this project because a lot of the companies we work with turned to us and basically all had the same questions. So the medical device regulation was sitting in their necks, and they didn't know how to deal with these new requirements. So we basically decided to put them all into one class and give them support here. And we kind of learned that this is also interesting for companies from abroad that want to enter the German or the European healthcare market. So we basically broaden the spectrum of support we give here, not just to the regulatory affairs, but also looking at reimbursement systems, so how to earn the money in the healthcare market. And of course, the next step is the implementation of the healthcare system here, for instance, in hospitals, but also in other healthcare providers. So we initiated the system. It's basically based on a funding coming from the federal government, and it is free of charge for the companies participating here. and we are also not taking shares in the company. So this is really just pure support for the development of these projects. And we also learned that you can't have a real accelerator running on a pure virtual basis. We tried that, but it wasn't really such a big success as we expected. We are now offering basic infrastructure for the companies. So we have this pre-furnished offices here that they can use. We have outfitted labs, wet labs, for instance, for cell and microbiologies. We have complete electronic workshop for the hardware equipment, and we also have an state-of-the-art 3D printer here that the companies have free access to work with. And of course, on the right-hand column, you see the full coaching and mentoring support that we are giving to the participants coming from startups and SMEs here in the region that have already gone through different stages of product development, that have gained knowledge here on how to tackle these problems. And of course, we still have the big clinics here we work with that can also give insight and support for the participants. What are we looking for? As I said, we want to work with startups and SMEs, so we are not focusing on turning scientists into businessmen. There's better platforms than us for that. We are looking for innovative medical devices and products because this is what we want to bring into the market. This is where we just want to support the further development of the local healthcare system by offering innovative solutions to the patient. And of course, as I already said, we need a certain willingness to be here in Leipzig, at least part-time. It doesn't mean that you have to relocate the company to Leipzig, but at least we want to see some of the employees here from time to time for the direct interaction. The only thing where you should have a presence here, a legal presence in the area, would be if you would, for instance, apply for grants in combination with the partners here that we work with. So the partners that we work with, just to give you a short insight, it's more than 70 partners at the moment, but these are the most important. So you have the clinics over here, which are two big local clinics. Helios is a private hospital chain with more than 82 clinics in Germany alone, some 200 medical care centers, but also clinics in Spain, in South America, and elsewhere. So this is also support for internationalization if needed. We have big medtech companies like Braun. We have IT specialists like Akka. We have the Hewlett Packard group for the 3D printing of medical devices, for instance. And of course, we have other partners like Amazon and that can support in terms of IT and all the web services needed for modern technologies here. Which is also important. We collaborate with notified bodies for the regulatory processes. We cooperate with health economists to basically break the ground for all those reimbursement negotiations with the healthcare insurances. Barmer is just one of those. We collaborate here with. We have a set of more insurances that bring in support and insight to the startups. So just a few words about Leipzig. It's as basically every city in Europe is right in the heart of Europe. That's what we always say. But I have to admit, it's a very beautiful city. I'm not a native inhabitant here. I moved here a couple of years ago, but I haven't regretted a single day yet. And the most important thing about Leipzig that I shall mention here is that we are a DHL hub. So there's 3 DHL hubs in the world, in I think Cincinnati, in Hong Kong, and Leipzig. So this is an excellent place for distribution of goods and products, which is also sometimes very important in terms of personalized medicines developed and produced here. So coming back to the main thing, we are now actively searching for applicants for the program. So the call is still open until the end of November. You can find the information at medicalforge.de, and yeah, so in December there will be a decision who will be the first 6 to 8 applicants in the program that will participate and that can start the journey with us in February next year. And we will continue this program each year. So it's a 12-month program. So you can expect that the next run will start in February 2023, sorry. And yeah, continuously we will select 6 to 8 participants to give the full support in developing their ideas and projects and bridging the gap into the market. And yeah, so if there are any questions from your side, we'll be happy to discuss this at any time. So here you see the contact data. And there's just one last thing that I would like to point out, since we have just announced this 2 weeks ago. You all may know the Bio Europe, which is the main conference for the life science industry, for tech transfer and yeah, all the economic development in combination with that. So we will host the Bio Europe next year here in Leipzig, and I would be very happy to see you here next year in Leipzig in October to, yeah, basically initiate cooperation and discuss on how we can collaborate even more in the near future. Thank you so much.
Thank you very much. Thank you very much, Dr. Hoffman. That was a great overview of the potential of a regional ecosystem. I would like just to stress a few points from your presentation. So first of all, investments in 3 years of over 4.5 million, funding 10 innovative projects on personalized medicine. That's what the regional government did. When we talk about value chain, that's, I mean, the hub, the infrastructures that the regional has supported are incredible. Like the kind of work that you deliver to support innovative SMEs to go through the regulatory phases, and also to the staff training program. That is really interesting. Is something that also in Italy we have, especially our foundation, Toscana Life Sciences, have already set. We call them ITS, which is Istituto Tecnico Superiore, and we are responsible for the health sector and the demand-oriented curricula, so training people on the basis of the industrial demand. That is something really good, which is working, and I'm very, very happy to see the outcomes that is delivering also in Leipzig. Thanks a lot. Like also the accelerative program, I believe there is main of the needs that comes from these aspects. So how to better support company. We have discussed in one of the pillars of Regions for PerMed, Dr. Eva Stegemann from the Saxony region is actually preparing the report and recommendation, and I believe that will be very interesting to disseminate that report, because it's tackling some of the issues that you have also presented today. Okay, thanks again. Without further doing, I'm very happy now to introduce a member of the Committee of Regions, Christodoulos Ianou. I hope I have pronounced well your name. We talk about local authorities. So we are regions, there are regions, and there are also municipalities. And it is my pleasure now to give the floor to Christodoulos to understand two main aspects: what the local authorities, the municipalities can do, and what the Committee of Regions can do, because I believe that this is a network, is a forum that the European Commission, member states, and us as a Regions for PerMed can leverage to involve more and more regions. Please, Christodoulos, the floor is yours.
Hi there. Hello to everyone. Thank you very much for inviting me and for the opportunity to be with you today. As you said, my name is Christodoulos Ioannou, and I'm a municipal councillor of Larnaca in Cyprus, and as such, a member of the European Committee of the Regions, which, as most of you probably know, is the assembly of local and regional representatives from across the European Union. The Committee of the Regions is a European institution that brings together elected officials from across the European Union. And if I may add, it's a very important one, although maybe sometimes a little bit of a neglected one in terms of what we can do, especially compared to the other European institutions. However, as I said, perhaps one of the most important ones, as we work on the local level, so we give this regional proximity that is very often needed. We're not based in Brussels, but across the European Union, and I would say that we are the body with the members that mostly bring, that are closer to the citizens and their constituents. The representation is direct and based on population. However, our work is mostly providing opinion and support to the European Commission and to the Parliament. Our decisions are not binding, and that is why we believe that a stronger Committee of the Regions can only help bridge this legitimacy crisis across the EU and bring the European Union closer to its citizens as the body with the most contact to that. So in that aspect, I would like to also welcome you, as this event is within the framework of the European Week of Regions and Cities, an annual event that we hold in Brussels, and we're very much looking forward to putting this pandemic behind us so that next year onwards we can return to a full physical European Week of Regions and Cities and bring all of us together in Brussels to share our opinions across a wide ranging of matters such as this one. Aside from the COR, in terms of the regional government, and we have to point out here that across the European Union, there is a varying degree of what each national legislation allows local communities, municipalities, and regions to do. Some have more power, some have less. Here in Larnaca, we are charged, if you want, with the running of the daily services. So our main goal is to improve the quality of life of our citizens, which can be as direct as coordinating garbage collection, regulating traffic, and so on, but also with the long-term strategic town planning and with helping the focus for the direction of our region and municipality. In terms of healthcare, we used to have a more enhanced role in this. However, for the past 2 years, Cyprus has rolled the National Health Service, which is bringing together the public and the private sector into one big system, very similar, if you want, with the system in the United Kingdom. So every resident of the island can have access to either private or public healthcare within the National Health Service at a much reduced cost, which is almost free. So what the municipality was doing before with providing healthcare services, especially to those most in need, is now different because of everyone's access to the National Health Service. However, our role is still to try to steer the direction of the policies to what better serves our constituents. Our role is to bring awareness to important initiatives, technologies, and new theories for us, the one of personalized medicine, of course, by introducing it to our members and by enabling partners such as ones found on this panel and beyond into penetrating this market, if you want to say, which maybe is not the right word when we talk about healthcare, and as such improving the quality of life of our citizens. As I said, the scope of each region is quite different, and what we are allowed by legislation to do or not. However, our role here when it comes to attracting initiatives such as this ones or investments and so on is to facilitate the cooperation of the private sector with the public sector, perhaps in our capacity provide some incentives for focusing on the local market to the extent that that we can through what we can offer and not, raising awareness, as I said before, and coordinating with our European partners. I would like to point out that our role is always very important, but at the same time, not vague, but maybe not distinctly, can be distinctly pinpointed. As you know, and I know from my participation to the Committee of the Regions that this works across the European Union, because we are the body with most contact with the citizens and the voters. We are the ones that seem responsible for everything. Well, this is not often the case, quite the opposite. So we get most of the feedback from the people regarding issues across the board, whether those have to do with national or federal governments or the European level or the local one. Most of that is not within our scope, and that is again the same for across the board. However, this element that we have, this characteristic of being so close to the daily lives of our citizens, is very important, and this is what the Committee of the Regions is trying to bring to the European level. It can be issues like the one on personalized medicine, and you can understand how politicians or technocrats in the European Commission, politicians in the European Parliament, they spend most of their time in Brussels. And while they have access to very important and very helpful and very strong research tools and a pool of highly skilled individuals that contribute to bringing all these ideas and developing these policies together, they lack the daily contact with each local community that we have. And that is why I said in the beginning that the Committee of the Regions is a body that can be updated and can be more helpful into bringing more than opinion on the table and much more than awareness of what is happening and what is important to our people. We are the ones that go back and have to explain European decisions to our citizens. And in that sense, initiatives such as this one can be enhanced and we can raise awareness much more across our constituents, but also to stakeholders, whether they are national or private stakeholders, in order to help shed light into this very important thing. Healthcare is, at the moment, especially after the pandemic, it's always been a very important, one of the most important factors determining our quality of life. But I think the past 2 years have shown how much more we should invest into improving the quality of healthcare, which is, in my opinion, at a very satisfactory level across the European Union. But of course, we always want to improve and be the best. And innovative theories such as personalized medicine can help make the European Union a global have a global spotlight into providing the best possible service to our constituents, which is at least the role of the body that I represent. I wouldn't like to take much more of your time. I'm more than happy to answer any questions as to how we can be more helpful in this initiative, how we can help expand synergies and more partners across the EU, and how we can overcome technical difficulties that exist right now and in the future. So thank you very much once again.
Thank you very much, Mr. Yano. Thanks a lot for give us the description how the Committee of Regions works. I have a question, because we are also out of time, but I do have to ask this question. Also building on Jean-Luc's presentation and partially from Dr. Hoffman, if we are trying to involve committed regions, as many regions as possible on the European Partnership on Personalized Medicine, and you say that one of the roles of the Committee of Regions is kind of support the European Parliament, and you are the body closest to local authorities, local governments, and citizens. What would you suggest to speed up the process, to ease the pathway to reach regions, and to explain them the importance of personalized medicine, the importance of the work the European Commission is doing on personalized medicine, not only Regions for PerMed?
Yes, in that sense, I have to point out something that maybe I didn't focus enough in my speech, which is the importance and relevance of initiatives such as this one, because many municipalities across the EU are large and have the administrative capacity to join European programs and invest in groundbreaking technology and new theories across the board, not just healthcare. However, many communities and many municipalities are small and do not have this administrative capacity. So initiatives such as this one help, the bottom-up strategy and help municipalities, communities, and regions join such initiatives and offer a higher quality of services to our people. And so it is very important to continue doing exactly what it is you're doing. In terms of how to spread, how to help this project from communities, we can certainly across the board help you raise awareness and bring you closer to stakeholders. Especially, I was watching the presentation from the European Commission before, which showed that not a lot of regions invest or participate or have personalized medicine as a priority in healthcare, which is something that of course shows us how much we need to work. And the best way to work with that is to go local, whether that is grant and large regions and municipalities, for example, Barcelona or Rome, or smaller ones like Larnaca or others, and show our people, most importantly, the importance of this, so that they take part and they ask for it from their national legislators and their European legislators, but also to stakeholders and local partners that can help improve of that, whether they are in the healthcare sector or service provision sector. It is very important to, it's not so difficult to create synergies that expand the magnitude, and the effect of what we do. So I would suggest that you reach out to more regions through the COR or directly, so that we can help spread the awareness for personalized medicine and take it from there. See how we can, local regions can participate in more programs, help them with their administrative capacity, so that they can bring these conclusions and these developments to the local market. And that is really what can help any initiative, but especially this one, take off.
Thanks a lot. We will definitely follow your suggestions. We have already started cooperating with you, and I would like to thank you once again for the support that you have given us in the past months. We will try to engage the Committee of Regions even more as our main stakeholder, and hopefully this will help spread the importance of personalized medicine and push regions to be more active, local authorities to be more active and investing more in personalized medicine. Okay, I think we are slightly over the time that we were supposed to take this event. So I would like to thank all the speakers that have joined us for this brief event that just took place. I would like to thank the partners of the Regions for PerMed Consortium. I would like to thank Claudia Mariut from my institution, from Toscana Life Sciences, and also the Utopia, the agency who supported us with the logistics of this talk today. And particularly I would like to thank Andrea Vodanovic and Carmine Nino. And of course, the Committee of Regions and the organizer of the European Week of Regions and Cities for the opportunities that they gave us today. Before I close the event, I would like to remind you that on the 1st of December, there will be a high-level conference taking place at the European Parliament. It will be broadcasted like this event today. Information are available on the website of Regions for PerMed, and I hope that you will join us and you will find the event interesting, and that you will spread the news and join the project and the work of the European Commission on personalized medicine. Thank you.